Hello, everyone, and welcome to today's event. I'm Steve Myers, Managing Editor of Digital Health Insights, and we thank you for joining us today. Of course, today's presentation is how digital inequity will undermine healthcare consumer experience. I'd like to thank the advisory board for helping DHI bring this special content to you today. A few notes before we get started. This webinar is being recorded and will be available on demand. Also, if you know someone who would be interested in the webinar but didn't register, they will be able to register later to view the on-demand version. Today's presentation will feature a slide deck, and then we'll have some Q&A as time allows. You have a Q&A function there in your dashboard. Feel free at any time to submit a question through the Q&A. We'll also monitor the chat just in case, but it really helps to have those questions in the Q&A box if you can. And today, of course, we're going to look at inequity. We'll look at how health systems are building out and planning and evaluating their digital transformation, for the customer and digital experience, and how to be more inclusive. And for this, we're in excellent hands today. As Director of Digital Health Research, Ty Adderhold currently leads the advisory board's research on artificial intelligence, digital strategy, telehealth, and digital health equity. He has also led advisory board's research on imaging performance partnership, focusing on outpatient imaging growth strategies, imaging appropriateness, and equity in cancer screening. Ty is a Harvard grad with a degree in history of science and a minor in global health and health policy. So as I said, we're in excellent hands, and you can take it away, Ty.
Thanks so much, Steve, and thanks so much for DHI having us here today. Really excited to talk with you all about digital inequity and how it's potentially going to undermine some of the healthcare consumer experience investments that we're making, particularly in the digital space. And to start off, I want to make sure we're all on the same page when it comes to digital inequity first. I'll get into a more detailed definition later, but at baseline, what we're talking about here is just one's access and ability to use the internet and connected devices. And right now, I think that digital inequity is going to be one barrier to consumer experience, but I also think at the moment, healthcare is still doing a remarkable job as well of imposing our own silos and inefficiencies on the people who are trying to find and receive care. And so today I want to talk through how we can avoid that. And this 4 questions you see here on the slide is going to serve as our flow chart for the day. So first I want to start off with discussing just what's going on with consumer experience in healthcare, particularly with digital consumer experience. What are we potentially overlooking about digital experience? What can we learn from other industries? What are we maybe not realizing we need to be investing in? And then third, and I think this is sort of the key to today's conversation, is how do we avoid leaving people behind as we continue to invest in digital experience? And then finally, I'll touch on just a few points of what do we need to avoid doing? What are some unforced errors that often happen as healthcare organizations invest in digital tools that can be avoided? So with that in mind, I will move us on to our first section today. And starting off with this slide, this is a graphic that comes from McKinsey, and it's comparing the relative digitization of different industries. And you can see that healthcare, we've highlighted it with that blue arrow on the bottom left. And it's probably not a surprise to many of you on the line that healthcare is following relatively low. We know this intuitively, if not from our own experiences. And this chart, it does come from 2019, and I know healthcare leaders across many different organizations have been investing quite a bit to improve this. We've recognized this for years, but the unfortunate, perhaps, news is that in the past couple of years, healthcare, while investing, is mostly just keeping pace, not necessarily catching up, because all the other industries on this slide also have been investing in consumer experience. And what that means is that still today, consumers have a better digital experience in almost every other interaction than they do compared to their healthcare interaction. And when I talk to healthcare executives, it's a big part of my job here at the advisor board to talk about issues like this. And when I talk to them and when you look at their investments, you see an enormous appetite out there to build out better digital capabilities. And that appetite and those investments are is really leading to this world that is characterized by the two statements you see at the top of this slide here. The first on the left is that healthcare is behind and therefore under threat. And then the second on the right is that we're seeing both investment and, for lack of a more technical term, fear of missing out, or FOMO, is accelerating. Let's start with on the left. Now, the fact that healthcare is behind is opening the door to new entrants, and those are entrants that have the capacity and the experience to build a great digital experience and then buy the care delivery assets, the healthcare specific features they need down the line. A great example of this that I'm going to touch on more in a second is Amazon. At the same time, we're also seeing that healthcare leaders are not simply content to build upon their anchor investments, things like an EHR or a portal. They're looking to new capabilities, new vendors as a way to differentiate, because they're realizing they need a new differentiating tool in order to attract new partners, new employers, and even new patients. Now, those two moves, I think, we're seeing across the board, but there's also some emerging themes that we're seeing. One is that it's not just new entrants that are sort of threatening here and under creating a situation where healthcare is under threat. We're seeing that the things that used to differentiate a healthcare organization, a telehealth offering or the ability to self-schedule, are becoming table stakes. So organizations are beginning to look to consumer intelligence and other newer technologies to help them attract patients and to build services that they know consumers want. And this is starting to put pressure on even progressive organizations. These organizations are being driven by, partially at least, a fear of missing out. They're reassessing their digital capabilities, looking for new partners and new solutions, because they feel like if they don't, they're going to be left behind. Now, I mentioned that Amazon is one of the big organizations that is leading to this sort of threatening, and I want to talk about Amazon for a second, because I think it's easy to dismiss Amazon as a serious player in healthcare, especially after the Amazon Care news offering. So they announced earlier this year they would acquire One Medical. Then just 3 weeks after that, they said, okay, we're going to shut down this homegrown Amazon Care offering. And I think at that point, it was pretty easy to dismiss of, oh, this is just Amazon continuing to iterate on their healthcare offering, but are they ever actually going to be successful? But I think their willingness to jettison Amazon Care actually shows that they do intend to succeed at a healthcare long term. The reason being is they weren't afraid to shut down a huge service that they had spent years growing in-house. And there's not other healthcare organizations out there that, frankly, I think would make that choice. We all know of the solution or the offering that wasn't going as planned, and we just kind of let it limp along. Amazon wasn't going to do that. They said, this isn't working, we'll shut it down. And that's just iteration and a choice that we haven't seen other organizations be willing to make. And at this point, because they have shut down Amazon Care, One Medical is now the centerpiece of their offering, not one component among many. And when you think of it that way, I think it makes even more sense why Amazon would go after One Medical. Amazon Care was a virtual and home-based model. And when that wasn't successful, I think it becomes more clear why Amazon wanted a partner that offered both in-person and digital health capabilities and offered it with great consumer experience and customer experience. All that being said, I do think it's important to keep in mind that massive disruption is not just automatically going to happen, right? It's not a given. No matter how much money Amazon spends or how many companies they buy, it's not easy. There's still a ton of execution challenges coming. But I think Amazon is certainly going to have an impact on the market in the same sort of direct consumer model that we've seen One Medical take. So at minimum, they will be disrupting through that lens. And I think they will also be looking to consumers in general because there are plenty of individuals and consumers in the US that are really looking for help. More Americans are struggling with mental health. We've also seen income decline over the past few years. And we're also seeing that consumers are more willing to break care relationships with existing providers. But just because they're willing to break that relationship, it doesn't necessarily mean that once they break the relationship, they're going to find what they need in the market. If you look on the right-hand side of this slide with me, you'll see that 70% number. That's 70% of consumers report that they don't have the support they need to understand or navigate their healthcare. And so when we take this data holistically, you start to get the picture that there's more individuals out there who are seeking care with less income, with less ties to their existing care relationships, but with limited understanding of where to go next and what their choice should be. And I think if you're Amazon or you're a digital health company in general, on the one hand, that's pretty exciting, right? There's a market, there's a place for you to step in and make a difference and capture some of these consumers. But on the other hand, I think it's important to note, and I'm going to spend a lot of today's session talking about this, that digital health isn't automatically the solution here. It's not just automatically you can step in and capture these consumers. And that's partially because there's still a gap between what healthcare is offering digitally versus what is actually being used in the market. Two specific examples of that on this slide. On the left, scheduling, on the right, visit modality. This data on both sides is coming from a doc ASAP survey that was conducted earlier this year. And on the left, they asked people how they currently schedule their appointments with a provider. And 3/4, as you can see on the slide, said they do it in person or over the phone, still using that analog method, whereas only about 15% were doing it digitally. But then when you asked how they want to schedule their appointments, jumps up to 30% that would want to do it digitally. So there's 2 times as many people that want to schedule digitally as are doing so now. And there's a similar story with visit modality as well. When asked, do you want to come in or do you want to have a video visit, 14% of consumers said they would prefer to have the telehealth option. That's not a ton, but when we look at the data, sort of some of the latest data around how many visits are actually being done via telehealth, it's only hovering around 5%. And that's still a big gap there. And that's a gap that is between the expectations, the desires of consumers and what is actually happening in reality. There's a few things that healthcare needs to do to close this gap. The first is to develop a better consumer experience. And our team has spent quite a lot of time this past year looking into, okay, what do we actually mean by a better consumer experience? And this is sort of the crux slide that we came up with. So we looked out of industry, we said, what is happening in other industries that is providing a great digital experience? And we came to these 5 components that you see listed across the middle of the slide here: functionality, customer service, self-service, personalization, and omni-channel. And on the top of the slide, we included some out-of-industry examples. These are the organizations you might expect to see here: Amazon, Netflix, JPMorgan Chase. But on the bottom half of the slide, we also identified some healthcare organizations that are demonstrating these capabilities. No surprise, for example, that Amazon and One Medical both have great functionality. Surely that was a part of the reason that Amazon chose One Medical specifically, right? They're already good at this thing that we're good at. It aligns. We put this slide here and those healthcare exemplars that you're seeing on the bottom of the slide to highlight that this can be done. This is hard for healthcare to provide great consumer experience, but it can be done. There are organizations that are meeting the rising expectations for care. So it's not that it's just so different from other industries that we can't do it, but there are lots of obstacles. And I don't think there's any healthcare organization that is meeting all 5 of these components. The other thing I want to note, though, is that we could solve all of the technical challenges for all of these 5 components, and there are still other obstacles in the way. And that's what I'm going to turn to next. The first, and I think one of the most important, so I really want to emphasize this slide, is that most patients in most markets for most procedures aren't functioning as consumers. And you'll see here on this slide that there are different factors that we put up here of what's necessary for consumers to actually go shop in healthcare. And you'll see, under the current state, if we said, does this exist or not? And it's mostly not there. Starting at the top, do consumers have options to select? Yes, that they have. But if you look on down, they don't have a lot of the other factors that are necessary. Do they understand the choices that are in front of them? Are they getting all the information they need? Can they make an accurate comparison or understand the final financial impact on them? The answer to most of these is no. And so when we set out to do research on digital experience, we expected to have, and I personally expected to have, a lot of conversations with organizations about what they were doing to address this problem, to create a more functioning consumer sort of economy, if you will, and to enable more people to go out and shop for healthcare. But as I had conversations with leaders, most of them talked and discussed consumers as if they already existed today, as if there was a market of consumers out there just waiting to be captured if they built the right tool. But in reality, I don't think most of their patients or members are able to act like consumers in any real sense. And so I think that makes me ask, who are we building all of these tools for? Is it just that small slice of the population that is relatively young and affluent and urban that One Medical is already capturing? Like, are we all competing just for that small population, or should we be building for a bigger population? And I think we should be building for a bigger population than a tiny segment, but I think we make a lot of assumptions along the way about who can use digital solutions as we do that. There's 4 examples of solutions across the top of this slide. And I want to caveat here, I'm not trying to single out any of these solutions. These are just the first floor that our team thought of as we built this slide. We could have put hundreds of different solutions up here. It's really just to make the point. So I'll start with Apple Health's capability around medication adherence that you see on the left. This was announced back in June. I think it's pretty long overdue for Apple, honestly. I think it's a great idea, and there's a real opportunity here to impact medication adherence. But also, if you look at all of the different requirements, or you could even call them expectations, that are placed on the patient to actually use this solution, it becomes a little more complicated. So the patient needs to have an iPhone and an Apple Watch. They need to have broadband access for both those devices. They need to understand how to use those devices, so have the digital literacy, and they need their medication health literacy. If one of those things is missing, they're either not going to use the solution at all, or they're going to try to use the solution, but it won't have the impact that you're expecting. It won't work the way that Apple Health or a payer or a healthcare provider would want. The same holds true across all of these innovations. Now, I understand that these are solutions being designed to serve specific kinds of members and patients, but if we think about the digital requirements and the expectations that we put on all of these solutions, I think we start to realize how small that market could be. And I also want to point out that all of these solutions are not only vulnerable to issues of broadband access or digital literacy, but also a trust component as well. Do I trust the information that I am sending is going to be safe, protected? Do I trust the organization I'm sending it to? And so when you consider all of these factors, we get down to a pretty narrow slice of the population that are going to be readily, easily users of these tools. Now, my point here is not that any of these innovations are misguided or wrong, or that we shouldn't be using these innovations. but that we need to think more holistically about these innovations and the market for them. So across the next 3 slides, I'm going to use a new resource that has come out from Microsoft, actually. They combine data from the census and the FCC, along with independent data from Broadband Now and some of their own internal data to create a digital inequity dashboard. This dashboard examines 20 different indicators across census tract, across the entire US. One thing I want to note right up front is that this is looking mostly at wired broadband access, and then do you have access to tools and devices? It does not include mobile. Now, it's an important caveat, so it's not a perfect tool, but I will spend more time on the end of why that doesn't matter. But the small TLDR here is mobile is not going to be a panacea for some of these issues for digital devices, mostly because mobile is more expensive. Certainly the data costs are more expensive in mobile, and it requires patients and consumers to make a lot of trade-offs of how they potentially use their data plan. Do they use it for healthcare? Do they use it for other reasons? So I want to get ahead of that, because as I've had conversations, I think the number one thing that comes out is, well, but this is just about wired. What about mobile? It's an important point, but bear with me on this one. So across the next 3 slides, we're going to look at digital inequity across 3 markets. We're going to start here with Detroit, and you have a heat map on the left. This is just a quick data viz of digital inequity across the city. Darker blue is showing less digital inequity in those census tracts. Most individuals will have access to broadband and a laptop, etc. The yellow and orange signal higher rates of digital inequity. Now, right away, it might be surprising to some of you just how much digital inequity is showing up here in an urban area. We usually think of this as a rural issue. And some of this inequity is tied to affordability. Can't afford to have a laptop, have a mobile device, can't afford to have a wired broadband access. But it's also tied to a business practice known as digital redlining. This is a practice where internet service providers skip over lower income communities when laying new fiber optic lines. And this certainly happened in Detroit. Nearly 40% of Wayne County, in which Detroit is located, is not using the internet at broadband speeds. The second example, I want to look at suburban Atlanta. I've highlighted a census tract here that is in the northeast suburbs of Atlanta in DeKalb County. This also happens to be about 10 minutes from where I grew up, but that's not why I highlighted this area. I chose this piece of DeKalb County because it highlights that digital inequity can actually be pretty hidden if you don't have the right metrics or you aren't looking locally enough. For example, on this heat map, there's a lot of dark blue in these northeast suburbs near Sandy Springs and Snellville. In fact, this one census tract is the only yellow-orange section of the map outside of the city limits of Atlanta. But in this census tract, 85% of households don't have a laptop or desktop, and 73% have no internet subscription of any type, and that includes mobile. Now, that would have a significant impact on this population's ability to regularly use, say, a patient portal. But I want to also point something else out. Even in this sea of blue that is the rest of DeKalb County here, there's still some digital inequity. Nearly 25% of the entire county is not using internet at broadband speeds. That comes up to nearly 200,000 individuals. But from a glance at this heat map, or certainly a glance at the average income level of this county, this inequity would never show up. Finally, I'll touch on the most obvious example, rural America. Here, we're looking at 3 counties in eastern Washington: Ferry, Stevens, and Okanagan. These are counties that are mostly in the rugged northern part of the state. It includes the Cascade and Kettle Mountain ranges. There's significant geographic barriers to broadband infrastructure here. So that's playing an outsized role in why this is showing up. But geography is not the only factor at play. There's also the same economic forces that show up in urban and suburban areas. All in all, 96% of Ferry County, 82% of Stevens, and 78% of Okanagan have individuals not using the internet at broadband speeds. Basically, if you're an internet, or if you're a healthcare organization with members or patients in this area, it's better to assume that your patients can't use digital tools, or at least couldn't use digital tools all the time, than to assume they could. And that really changes how you should approach investing in digital tools and how you should approach your digital experience. Now, beyond market sizing implications of digital inequity, we're also starting to see some evidence that digital inequity is directly impacting patient health. This is a study that recently appeared in JAMA, and it's found a link between the lack of internet access and higher COVID-19 mortality rates. On the left-hand side of the slide, you can see the researchers found that areas with limited internet access had higher COVID mortality rates across all community types, but especially in urban areas. Now, the authors of the study said they weren't surprised that they identified the association between low internet access and high mortality rates, but they were surprised by the strength of the association. If you look at the middle of the slide here with me, the researchers estimated that for every 1 additional % of residents who had internet access, between 2 and 6 deaths per 100,000 were preventable. And I think most surprising is that this wasn't just a proxy for other social determinants or demographic factors. The researchers, when they controlled for age, education level, socioeconomic status, and other factors, found that it did not remove the linkage between internet access and mortality. Now, there's many reasons this could be the case. The researchers weren't able to discern exactly where this impact was coming from, but one of the reasons they posit, and certainly something that makes sense to me, is that the internet has become sort of fundamental to how we access information in today's age. So it's not just tied to education and economic stability and community, but just also being updated on what's going on, how to remain safe, and for this case, a pandemic. At Advisory Board, we firmly believe that your organization should be thinking of digital inequity as a social determinant of health. As I discussed in the previous slide, it has an impact and it's becoming essential for education, for finding and keeping employment, any number of things. If you look at all of the investments that healthcare organizations are making, technology is also becoming increasingly essential for receiving care, for finding care, for tracking your health over time. And what compounds the problem is that in reality, digital inequity is a pretty complex thing. You can see sort of how we break it down on the right-hand side of the slide here, looking at this wheel graphic. First, it's made up of the things that I've already discussed, things like broadband access, affordability. There's also things that are much harder to measure, low digital literacy. Even how we think about inclusive and accessible design of digital tools and experiences, trust, as I mentioned briefly earlier. All of these things, they can be interconnected, they can come and go in different populations, and even if they present in mild cases, will undermine the access and the experience that healthcare is trying to get at and we're trying to move towards. A successful product team will tell you if something's too hard to use, it's too hard to learn to use, nothing else matters. It just won't get used. The customer won't use it. Now, before I move on from discussing digital inequity, I do want to note one other thing here. You'll notice that I've consistently used the term digital inequity and not digital divide, and that's very purposeful. It's a decision that I made and our team made when we first embarked on this research at Advisory Board a few years ago. And I want to encourage others to avoid digital divide as well, because while I recognize it's catchy and I like it sounds nice when you say it, I don't think it does a great job of explaining the actual problem here. I've listed those reasons on this slide. I think when we talk about digital divide, it can make it feel first like it's someone else's problem. This is just a divide in the society, like all these other divides exist, whereas the truth is that digital inequity is a problem for every organization that is adopting or investing in a new technology. Divide also suggests that this is an infrastructure problem. That is, to extend the infrastructure metaphor, that a divide can be bridged just if we build the right thing. That kind of thinking also leads to a third problem, that there's a single finite solution, that is just the infrastructure solution of laying more cables in the ground, for example, putting more fiber optic line in. And that's not the case. And then lastly, and I think this is the most important, digital divide implies that this is a binary, that this is a world of haves and have-nots, when in reality, patients can experience challenges across a spectrum of ability and access, and patients can actually move back and forth across the spectrum if they sometimes have broadband access and other times do not. The good news here is that if we think of digital inequity on a spectrum, it's much easier to see our way to potential solutions. And there's a business reason to think this way. Digital inequity existing on a spectrum means that there are plenty of people with broadband, with a smartphone, who still experience digital inequity, and that could prevent them from using a digital product. Now, if we can simply move them one step down the spectrum towards digital equity, makes it more likely that they will use a digital solution in the future. And then think as well, that's expanding the potential market share. That's what you have on the left. But you also need to think about the amount of data that you're currently getting versus what you could get. If you only are getting data on certain type of consumers, those that are most digitally enabled, you're not going to be able to build tools that have greater reach, that will be usable for more people. So if you're able to expand your market share, have more individuals using your digital solutions, you're going to increase the scalability and the potential of those solutions going forward, because you'll be able to build new capabilities that better match what people need. Finally, consider a world that I think most of us presume we're still working towards. That's one where value-based care is far more prevalent than it is today. And in that world, digital tools are going to have to be a key asset in improving outcomes and decreasing cost of care at scale. But if we only focus on consumers who today meet all of those requirements that I discussed earlier to use digitally enabled solutions, those individuals who are able to currently use their iPhone, their Apple Watch, have all the digital literacy necessary, we're probably not going to be focused on the patients around whom value-based care can create the most potential savings. So we're not going to be moving ourselves towards that goal. So how do we get there? How do we avoid leaving people behind? First, it starts with data and getting better data. I'm sure that's not the most surprising answer, but it's true. Unfortunately, there's not one metric that is out there that is going to tell you who's suffering from digital inequity in your community. Even that Microsoft tool, as good as it is, it doesn't account for, as I mentioned earlier, mobile. It also doesn't account for something like digital literacy. But it is possible to layer together several metrics to build a picture of who faces those challenges. That was how Seattle Children's Hospital figured out what patients needed support in their community. They created a heat map that targeted 5 to 6 social vulnerabilities, prevalence of multifamily households, lack of internet and transportation issues. They layered patients' locations and no-show rates on top of the social vulnerabilities to create a clear picture of need. Those different vulnerabilities could be toggled on or off so that the organization could better deduce the methods of support they needed. That could mean providing a loaner device to a patient and having a cellular connection on that loaner device, or leveraging community kiosks that they built and put into the market, or even providing some patients with gift cards to help pay a cell phone bill or transportation costs. Another consideration here is that digital can actually be a tool to address inequities. On the top half of this slide, we've sort of placed a member's or a patient's desire and ability to interact with healthcare on a spectrum. On the left-hand side, we're talking about the independent individuals. These are the members or the patients who want to use self-service solutions to find information, to solve their own problems, and complete their own tasks. These are the individuals that don't want to have to talk to anybody. They just want to click through, have it solved themselves. But then on the right, you have those that are less independent, that do want to pick up the phone and talk to someone. And that can be because they just prefer that way, or it can be because they don't have the ability to use self-service solutions, whether it be because they don't have a broadband connection, or they don't know how to use their laptop in that manner, or because the website isn't in their native language. These are the individuals who need or want and appreciate the extra handholding that they can get from analog and conversations with staff. Now, if you invest in a digital solution that works for all of those individuals on the left, that will free up staff time. And if you do this in a purposeful manner, you can use that freed up staff time to retrain staff and provide better support to those less independent members. Then those less independent members have a better experience, they have better interactions, quicker wait times, etc., for their analog process. We're making it better for both parties here. But one caveat that I want to emphasize is that you have to make a conscious decision to that. Just investing in a digital solution doesn't automatically shift your staff's time to helping those less independent consumers. Instead, you have to make that conscious choice to direct staff time in that direction in order for the impact to actually be felt. Now, regardless of what type of digital solution you're implementing, it also needs to be easy and familiar to use. Not only does this help bring in those digitally enabled consumers who want that easiest as possible experience and to match the easy experience they have outside of healthcare, but it also helps ensure that patients with lower digital literacy still have the chance to navigate and use the tools. On this slide here, we have an example from New York City Health and Hospitals and their virtual urgent care service. When they first rolled this out, their entire goal was to remove barriers to access. They also found that creating a familiar feeling with this new model helped with the stickiness of it and that people were returning more often because it was so easy to use. Now, the key to this was actually a staff role, the support hero. The support hero is sort of the staffing role that is the glue that keeps this all together. They take on all of the non-clinical work away from the clinicians. They do enrollments into primary care. They do insurance, registration, data collection, next steps once the clinician is done. And this makes it easy, straightforward, and sort of mirrors some of the in-person clinic experience that patients might have. They didn't stop there. They also used this program as a way to rethink their urgent care pathway altogether. Instead of digitizing every step from that in-person pathway, they rethought what they needed. And when we think about, this virtual urgent care, the care is traditionally app or portal based, and that means that users often have to jump through a lot of hoops. I'm sure we've all been there. You have to download the app, sign up, set your login and password, your two-factor credentialing, then you have to click into a different portal at some point. And as all of that is happening, you're also asked to fill out surveys, unnecessary fields, or at least they feel unnecessary, to get as much data as they can about the patient. New York City Health and Hospitals didn't want that. They wanted to avoid that if they could. And so they used a want versus need framework to focus the product's design on the patient. They wanted to remove as many barriers as they could. And what they realized is all they really needed was a phone number, a name, and symptoms. Everything else was a want. With that clarity, they chose to only capture the needs that you see listed on the right, and then track down the other pieces of the data later on in the visit, or not at all if they didn't need it. I think this is the ideal that we should be striving for here as we consider digital experience, because it's not just a better experience, it's also a more equitable one because it's so much easier for people to use. Now, I said back at the beginning of the presentation that healthcare is great at imposing its own silos and inefficiencies on people trying to find and receive care. And I think that becomes especially true when we think about the entire care journey and not just our individual piece of the journey. The reality of our healthcare system is that in almost every case, any healthcare organization is only responsible for a part of it. The patient is experiencing it all at one thing. Anytime we can acknowledge that or work together to improve that, we should. Not only because it's right, because if you don't, then we're potentially wasting money on solutions that can't possibly solve the problems we have at scale. And an issue, a care experience that a patient has with some other organization may reflect poorly on us, because it's not always clear to the patient, whose problem or who is responsible for the negative experience. Now, to wrap up today, before I get into the Q&A, I want to share two important points that have emerged across the work my team has been doing for the past couple of years now on digital health. And I'm calling these two out because I think they're both going to be key for any organization that is attempting to change their digital experience, whether you're building or buying or some combination of the two. The first is about making sure we're accounting for the impact of change from digital disruption. That's what we're talking about here. You may be aware of the adaptive challenges that your teams are facing as you implement new digital solutions. I think it's easiest to think through this in examples between technical and adaptive challenges. Technical challenges are, at their most basic level, just diagnose and repair. What's the problem? How do I fix the problem? This is a message not sending in a patient portal or a telehealth appointment app interrupting a physician's workflow. Usually these are relatively easy to come up with in a brainstorming session, even if they're not always easy to solve. But adaptive challenges, those can be a little more nebulous. These are things that are, a threat to our team's sense of identity or of their own value. An example would be a provider who believes that the care they're providing through telehealth is just not as good as the care they're providing in person. That's an adaptive challenge. These are harder to identify, they're certainly harder to talk about, and yet they're essential to make the kind of transformational change we aspire to. Now, the second point here that I want to make is that I think consistently in healthcare, we are quick to blame the other guy, especially around technology. Our team has done some work recently to understand the root causes of why technology investment is so often disappointing and so often leads to this blaming of the other organization. The reality is that oftentimes it's internal tensions, not external interactions, that make it harder to achieve ROI from any one technology partnership. Now, on the vendor side of things, some of the biggest internal issues include, overselling the promise versus underselling the hard work that's absolutely necessary to achieve this ROI or the expected outcome. This is all about expectation setting. I think also on the vendor side, there is a pressure to sell to just about anyone versus the painful retention that can cause on the back end. A vendor can't afford to say no to potentially bad partners, and that then forces the vendor team to go heavy on customization and hurts margin in the long term. But there's also internal tensions on the customer side. An example of this would be, the static RFP process versus the rapidly changing technology needs. RFPs can be great. It's a familiar, tried and true process. They can be helpful in narrowing down options, but they can also be a little too rigid, particularly for systems that are looking to purchase rapidly evolving technologies. And finally, I think the hardest pill to swallow here, potentially for some of you on the line, is that I think customers have more flexibility to adapt to these realities than vendors. Customers have more stake in their operations, and most importantly, I don't think they're beholden to the same financial expectations that are driving vendors in these scenarios. Vendors are going to sell. It's not going to be able to change. That's what they have to do. So if customers want to relate differently to tech vendors, it's going to be customers that have to do some of the flexing. And to close, I want to highlight that this is especially true when it comes to who these tools are designed for and who they will work for. It's going to be the customers that have to be advocates for digital equity in these vendor conversations. They can't expect for vendors to be doing this on their own or taking these considerations in and bringing them to the conversation, they have to ask those questions in the conversations, in the partnerships. How can we open this up for more people? How much data is required to use this tool? Or can there be a store and forward option? Any number of these questions can be brought into conversations to raise the concerns around digital equity. Because I don't think we're going to achieve our goals for digital and healthcare if we continue to operate without considering the implications of who can use the tools we're investing in. Now, that brings us to the end of the time today. So I want to open it up for questions and any conversation.
Thank you so much, Ty, for providing such great insights, and the slides were really packed with some great information about healthcare digitization and some different ways of looking at health equity and how it impacts customers and providers. We do have some questions. Also, I wanted to let the audience know that we put a link in the chat there. With such great slides, I know people will want to see them again. And so we have a link there for people to check out your slides. And we thank you for that. So continue to put your questions in the Q&A function. We'll get to the questions that we can. For the first question, it goes back to the numbers that you shared on digital inequity. For digital inequity, are there numbers for the other variables you discussed? So other than regional, what percentage are digitally illiterate in the high broadband areas? Or do you have these numbers by any other demographic indicator?
It's a great question. First, I would recommend going into the Microsoft tool. It's publicly available. I can potentially find a link. We also have the sourcing and the slides. So if you have access to the slides, you can click in and find that. But in that Microsoft tool, there's 20 different variables they look at, including some other demographic indicators that I didn't share, and you're able to click in and customize it. So that would be a great place to start. In terms of digital literacy, I don't have hard numbers. I wish I did, and that's mostly because there's not any one standard measurement of digital literacy, and it's really hard to capture and accurately measure. So what I can say is that there are tools out there and quick surveys designed to get an accurate measure of digital literacy. And one of my recommendations is to find one of those and start using them, whether it's members or patients, to collect some of that information, to understand what's going on in your market, to understand in your community how much of a problem this is.
And of course, you were talking about the Microsoft tool. Do you have any other insights or information on how the data in terms of digital inequity, how the data was collected? Do you have any more info on that?
So I know in the Microsoft tool, they're both looking at sort of some of the FCC maps that are out there as to if people have wired connections. But more importantly, they used sort of independent data from Broadband Now, which is a nonprofit that has been tracking this for a number of years. And that has much more specific sort of block by block data on which households do have broadband access and wired broadband or not. And so that was sort of the majority of what that Microsoft tool was built on. Another area, I would say, another organization that has been collecting some data around digital inequity, whether it's broadband access or other things, is Pew Research Foundation. They've also been a great resource that I would definitely check out. They send out surveys fairly regularly about some of these types of questions.
Okay, thank you for that. Back to the topic of digital literacy. What are some ways to reduce the digital literacy requirements of digital health tools?
It's a great question. And it's certainly something that I think more organizations need to consider. At a very basic level, this is things like just limiting the number of potential options that are displayed on any one landing page or web page, for example. If you are able to sort of guide the patient through and make it very obvious sort of what the the potential next steps are for them or where they should be clicking, that can be much easier than sort of having an overwhelming amount of information there. Another thing that healthcare specifically, I think, is behind other industries on and is overlooking is the importance of the ability to view, any website or any piece of information in someone's native language, for example. That can make a huge difference in the ability and desire for someone to actually click through and use a digital tool. And I think other industries are ahead of healthcare on that in a lot of areas.
Okay, and you talked a bit about investing in digital, and you talked about the disparities. How can programs invest in digital solutions without widening disparities in access, making things worse?
I think, the first thing I would highlight, and this goes back to sort of what I mentioned earlier around the ability to free up staff time. I think that's one easy way to consider this of, if we invest in a digital solution that allows those who are very independent and just want to click through and do everything on an app or a website to free up staff time, that's an easy way to consider this. I think longer term and more big picture, it's thinking about how do you minimize the digital requirements in the digital solutions you're investing in. So I mentioned very briefly at the end there, something like store and forward. So the ability for an app to collect information, even if at the moment the individual is not connected to a broadband connection, and then later on when they do have broadband, send that information along. This is something that some RPM tools offer. That's a great example of designing in a way that understands there might be times where someone doesn't have a connection and allowing the tool to still work. And so I think the more we can have conversations with vendors around that and identify other opportunities to do similar things, the better it will be in terms of bringing everyone into sort of the digital age of healthcare.
Very good. And when you talk about some of the aspects of inequity, like broadband access, we saw the maps and whether people are connected to and using broadband speed internet access and things of this nature. These are, you made a good point about how these are some of the considerations you have to heed in this digitization of healthcare at the current moment. If you look out ahead, is it even reasonable to think 5-10 years ahead? Is there going to be a time where everyone has the broadband access and that aspect becomes less and less of an impact? Is it even good to think that way?
I think, it's a real question. And first I would say, I hope we're moving that direction. I think outside of healthcare, we're seeing in education, for example, a lot of pushes to improving some of this access. And I think that will over time have a big impact. I think what will actually happen is we'll see a shift in what factors are most important to consider. 10 years from now, you may not have to worry about broadband at all, but I think you'll probably still have to worry about the digital literacy piece. And certainly I think you'll have to worry about the trust piece of, even if someone is connected, does have the digital literacy to use the tool, do they trust that the information they're giving me is going to be protected and used in the right way? And how do I bring that level of trust to them so that they will actually use a digital tool? And that's going to be on healthcare organizations to figure out. I think the other piece here goes back to the sort of consumerism shopping angle of we could solve a lot of these digital inequities, but if we don't build an ecosystem where consumers feel like there is an actual reason for them to go to these digital tools and look around and look for healthcare digitally, that could also be a barrier, even if we solve some of the digital inequity pieces.
Very good. Thank you. I don't see any other questions coming in, and we're running up against the top of the hour. So what I'd like to remind everybody is your contacts there on the screen, so they can certainly reach out to you. There was quite a lot to digest, and I think we all learned quite a bit today on different perspectives, different ways of looking at equity and the impact. And so they might want to reach out to you at a later date. Also to remind that the link to the slides is over there in the chat, which is great because that's a question we often get, the slides. And then also you'll see in the chat, there's a link to provide some feedback. It is really helpful to get feedback. And so if you click on that link and give some easy feedback, we definitely appreciate it. Also to remind you that the webinar was recorded, it's available on demand. So if you want to jump back in and check out a piece of this, I know there was a lot to see. There was a lot on the slide, so you can jump back in and that people can still register to see the webinar on demand. So Ty, thank you very much for such a great presentation.
Thank you for having
The
me.
advisory board, thank you for helping us bring this great topic in a webinar format to the audience. Thank you to the audience for being here and being engaged. And this concludes the webinar.